Okay, so the first question is, please introduce yourself and some background information on your research career. So my name is Georgie. I did my undergraduate and PhD in psychology at Cardiff University. After this, I conducted a number of different postdoc positions. They were all still in the School of Psychology at Cardiff. And I also took a career break for maternity leave. And throughout this, I think I did work in various part-time contracts, and I kind of went from one postdoc position to another. Okay, so the second question is, what award do you hold and how long ago was this awarded? So I hold a social care research fellowship, and this was awarded in 2019. My fellowship only actually began in 2020 though, because I actually went on maternity leave for about 10 months straight after I did my interview for my fellowship. So it was a little bit delayed when I actually started it. And I think I'm working on my fellowship part-time, so it's 3.5 days a week, and over 4 years, so I have about 2 years left now. Could you give an outline of the project that you obtained the award for? So my project is exploring the use of smart technologies, particularly smart speakers, in social care settings. I'm particularly interested in people with a learning disability in supported living settings, and also older people living in social housing. And I'm interested in whether these smart technologies could help to increase digital inclusion, to help people to live more independently, being able to access information easier, being able to access entertainment easier, to make phone calls if needed, set reminders to take medications. And if by doing all of this we see any increase in or improvement, I should say, in well-being. How did you ensure that the project fitted with the remit of the award? So I did a lot of research in preparation for the application. So I read widely around kind of what was happening within social care in Wales, Welsh Government strategic priorities, policy documents such as the Social Services and Wellbeing Act for Wales. I also spoke to different social care organisations. I spoke to people who would eventually become my public research partners about their priorities, and they were really helpful in the design of the study. And I really tried to think about designing the study to ensure that the results would have kind of meaningful and tangible impact to the stakeholders, both in Wales and beyond. And of course, in addition to this, you know, sometimes the priorities for the different calls do change over time. So it's important to really carefully look at what guidance Health and Care Research Wales have given you in the call documentation, and to use that, I suppose, as a basis for your research, but also do have this kind of global understanding of the context of the area that you are hoping to research. So how did you go about gaining the necessary support from your organisation? Well, my organisation, School of Psychology in Cardiff University, was extremely supportive of my application, really from the very beginning. I mean, I think what I can say on this is that it's really important to speak to people about your ideas and your intention to apply for one of the schemes as early as possible. So kind of try to get advice before you even start kind of putting your fingers to the keyboard. So very early on, I spoke to my head of school and told him that I was thinking about applying for the fellowship, and you know, to ensure that they were going to be supportive of my application. Then probably my next kind of big decision was who to approach to be my mentor for my fellowship. I think this is a really important decision. For me, this was quite obvious, and I already had quite a good relationship with the person who ended up being my mentor. But I spoke to my mentor early on to ensure support. And then I started speaking to kind of social care organisations who were going to be involved in my project, potential public research partners, and I started to kind of get into place my advisory panel as well. So who supported the application? So as I said, I sought out a lot of support for my application. I think it's really important that you talk to lots of different people, talk to academics, but also talk to people in sort of key stakeholders, people involved in social care, public members of the public, for example. And it's really important to be kind of proactive about this. So start doing this very early on in the process when you're really starting to try and formulate the idea, the kind of research idea and design. So I suppose in terms of who supported the application, firstly, it was my mentor. So I discussed my ideas for the design of my project very early on with my mentor. But I also did speak to other members of academic staff as well. And everyone I spoke to was really supportive. I think a lot of senior academic staff, if you kind of pluck up the courage to talk to them, will be really supportive of early career researchers seeking to kind of make those first steps into kind of an independent research career. I received quite a lot of internal peer review on drafts of my fellowship application. This was really helpful to get kind of different perspectives from people who maybe come from different disciplines kind of related to your area. And this really helped me to identify and remedy any potential weaknesses that might have been in my design, to clarify sections that maybe were a bit unclear. It was really helpful. But eventually, I think with internal peer review, you do kind of reach a saturation point where, you know, you've received so much feedback. Eventually, you do have to kind of make executive decisions and do what you kind of believe is right for your fellowship application. So it's good to seek advice, but you also need to have your own ownership and your own, I suppose, vision of what the application is going to be. And don't lose that too much if you get kind of competing feedback. I also sought support from my advisory group. So this is comprised of public research partners, representatives from social care organisations, and also academics from other institutions as well. What was the application process like, and how long did it take? I did work really hard on the application, and I felt like it consumed a lot of my attention for probably around 2 to 3 months. So when the call first opened in September to when it closed around the end of November or December. I was in the first trimester of my pregnancy at the time, and I also had a young toddler at home. So I was quite tired and not feeling 100% all the time. And I think it might have been easy for me to kind of give up on the application. I did consider that at some point because it was a lot of work. It really was a labour of love to put everything together. But I'm really so glad that I didn't give up, because I think kind of what I've learned is that writing a fellowship or any kind of significant grant application, it is really hard work. It is really time consuming, but there's never necessarily a good time for this. You're always going to be busy. There's always going to be competing interests. Sometimes, you know, you just have to kind of go for it, make the decision, yes, I'm going to do this, and know that it will be worth it in the end if you do get the fellowship. But even if you don't get the fellowship, I think that writing it through the process of writing an application, it really does clarify for you, I suppose, your kind of longer term research vision. And it might be that you can kind of adapt the application or improve the application and then submit it again, either potentially to the same funder or a different funder in the future. So I feel like it's never wasted time, but at the same time, sometimes it can feel like there's never a good time to do it, but sometimes you just have to go for it. What did you find the hardest part of the application? So I think the hardest part for me was kind of bringing everything together within the time frame. So I had started preparing for the application before the call was even announced. I'd already been thinking about the study design. I had a study in mind, and I had already been thinking about it, and I'd already been developing connections and kind of working with people in preparation for submitting some kind of funding application to do the project. But I wasn't exactly sure what the call was going to look like. So to some extent, I was a bit limited in exactly how much I could specifically prepare for this specific call. And then there were kind of within the time frame in which the call opened, which was about 2 or 3 months, there were just a lot of different elements to all bring together. You have to kind of get a draft application, write all of the different sections, research kind of things related to the different sections. You kind of want to get a draft as soon as possible so you can send it out for internal peer review as soon as possible to get feedback on it. But at the same time, I was trying to figure out all of the costings and the justification for resources. At the same time, I was also trying to kind of speak to members of my advisory panel and kind of confirm their commitment to be on my advisory panel. I was trying to arrange letters of support. These can take some time sometimes if you're trying to get a letter of support from, say, somebody at a local authority who's extremely busy. It can take a little while for that to kind of trickle, for you to get an actual physical letter. Ensuring that I was up to date with kind of all the kind of strategic priorities or the recent advancements in social care. Sometimes it was hard to know which of these to prioritize. They all seemed to need to happen at the same time. So I did feel like you needed to have a lot of organization and to really think about the priorities and keeping track of time to make sure that you were kind of working on things and giving enough time, allowing for enough time for certain things to happen. For example, 4 letters of support to be generated. So I think that was probably the hardest element for me, was just coordinating all the different elements. Following the submission of the application, how did you find the rest of the process, including the interviews? So the rest of the process was fine. It was really interesting reading reviewer comments to kind of see the different range of potential both positive comments and also comments that I could really think about, that I think were really important in the long run. Actually, I think they really helped to make the project as a whole better in the end. So it was really useful to have that feedback. It was useful to have reviewer comments because I felt more prepared going into the interview. I kind of felt like I understood the different potential areas or questions or uncertainties that might be brought up in the interview context. My organization or staff within my organization organized a mock interview for me, which was really, really helpful. I would definitely recommend looking into this. I'd never been in a interview situation for a grant application or a fellowship before, so I didn't really know what to expect. And so even though the questions weren't the same, it just being able to kind of be in that situation where you're answering questions about your project was really, really helpful. So I think definitely preparation, do your homework beforehand to make sure you know your fellowship, know your research around your fellowship, make sure that you have done that wider research also about social care, or your kind of the global area that your research kind of fits into, and preparation is the key, I think, for the interview. The interview itself, it was fine. Everyone was very friendly, everyone was very nice. I'd actually had a C-section 9 days before, so I had to bring my newborn along. That was probably the most stressful bit of it. But I found that Health and Care Research Wales were very responsive and understanding of that situation. How do you find reporting on the progress of the project? We submit quarterly progress reports, so 4 times a year, and I find that these aren't too time consuming to complete. You don't have to write too much on them, but I think they're a really useful exercise actually for me, as well as obviously for Health and Care Research Wales, because it's a nice summary of kind of for me about how progress on the project is going, and kind of keeps it's kind of a helpful reminder of the objectives that I need to do kind of in the next 3 to 6 months. So I think it's the reporting is fine, and I think it can actually be very helpful. Any tips for submitting an application? So read the core guidance very carefully. Make sure, they can sometimes be long documents, but they are really, really useful documents. So go through them, read them really carefully. Make sure that in your kind of that when you write kind of within the different sections of the application, that you're really kind of answering the question that they are kind of getting at, or providing the information that they want within those sections. Seek advice from peers and colleagues, those kind of both with experience within your area, but also talk to people with experience outside your area as well. You need your application to be understandable to a wide range of readers. So it's really helpful to give it to people who really aren't familiar at all with your methodologies or your subject areas, to ensure that that they kind of can understand it, but also that they see the benefit and the impact of it as well, that is really coming across. Do your research. Preparation, I think, in research is the key to this. Understand where your project fits into kind of the global context of social care, or healthcare, for example. And think also about how the fellowship would kind of fit in with your global research vision, or your vision for your future career as well, because in the end, fellowships are really about the individual. They're about their career development, fantastic career development opportunities. And so think about what the benefits of the fellowship will be for your career, and what the benefits, what you can then continue to bring to maybe social care or healthcare, from having done the fellowship. Get advice from people and think hard about how to strike the right balance between ambition in the research but feasibility as well. So I think it's really important that the research is novel, it's significant, it's ambitious, but it's also really important that it's feasible, that you've considered how to mitigate different risks. And this is an obvious area for reviewers, for example, to kind of question. They've said they're going to do all of this. Is this possible within the time frame? Is this deliverable? Know that writing the application and the interview, it will be hard work, it will be time consuming, but it really is worth it in the end. And even if you're not successful, I think that you will have gained something from going through the process of writing the application and thinking about the application. The feedback that you've received along the way will have been really, really helpful. And I do think that it is a skill to write successful grant applications, and it's not something that we're just born with. I think it's a skill that we have to learn through practice, through seeking feedback. And so the more you do it, probably the better you'll get at it. And I think I'd just like to finish by saying it's not really a tip, but just to say that these kind of fellowships can really be completely transformative for your career. So I now have a permanent lectureship in my department, and I really don't think that I would have been competitive for that lectureship had I not got my fellowship. So for me, going through the fellowship process, even though it was very hard at the time, has been hugely beneficial to my career. And I'm so glad that I made the decision to go for it. Okay, so there was a question about my mentor, how they support me. And so my mentor was really supportive when I was developing the application. Before I'd even written anything, I talked through my ideas for the design of the study with my mentor. They were really helpful in helping me to kind of understand what might be feasible within the project. They were helpful in advising me on the costings for the project. When I had a complete draft of my application, my mentor kind of read it, made comments. it was really helpful because my mentor is not kind of directly in the same area that my project is, but she is involved in social care, so she could, I think, really bring that kind of more higher level global understanding of where my project might fit in, which was really helpful. So now that I've throughout the kind of duration, but my mentor was also helped with the mock interview in preparation for the fellowship interview, and then now during my fellowship I meet with my mentor at least once a month, but to be honest we also have a lot of informal chats kind of at different times, and if there's any concerns or queries that I have about how my fellowship is going. So my mentor was really supportive. For example, during the pandemic, my fellowship started just as the pandemic started, and my populations, people with a learning disability, older people, were kind of the worst possible populations to be studying in a pandemic, when I was supposed to be doing a lot of face-to-face interviews with participants. And so my mentor was really helpful in supporting me and advising me throughout that process. But in addition to the mentor, don't just have one person. It's also good to have an advisory group of different people with kind of diverse experiences and interests to also be able to consult with. And you know, generally, at least in my department, I found that senior staff have always, or colleagues have always been extremely supportive and are always there to offer advice and support.